Today, Governor Roy Cooper said North Carolina was seeing what he called shockingly high numbers of coronavirus cases coming from the long-term care centers. Outbreaks are now reported at more than 20 locations in North Carolina. That includes a facility in Orange County where 60 people have tested positive for COVID-19. CBS 17's Amy Cutler live tonight in Pruitt Health Carolina Point. And Amy, you spoke with the person that lives there.
I did, Angela. He is 74 years old and tells me his roommate went to the hospital with a high fever. Now, he was tested for COVID-19. He tells me, fortunately, the results came back negative, but he's concerned that could change.
Pruitt Health Carolina Point promises exceptional care in a home-like environment. Tonight, the Durham nursing home has become the latest example of how quickly coronavirus can spread. The state confirming 2 people, a healthcare worker and a resident, tested positive for COVID-19 about a week ago. Now at least 60 people have it. 2 of them have died.
We found that out today when it was announced on the news. We knew nothing about it.
I spoke with this 74-year-old resident over the phone. He asked that we not give his name because he's concerned about retaliation. He's called the facility home for almost 4 years.
My roommate last week left with a hot temperature. Duke came in, and I know they gave me, I think, and others, tests for the ground. I got the results today. They were negative.
The Orange County Health Department says Carolina Point is one of 2 outbreaks they're dealing with. Another 3 people tested positive for coronavirus at Signature Healthcare in Chapel Hill.
Once the virus is in some of these long-term care settings, it's incredibly hard to control.
At the state level, there are 21 outbreaks. 18 of them are at long-term care facilities, which is why the governor signed an executive order requiring staff at these facilities to wear masks, closing communal areas, daily screenings for staff. Those infected will be kept in separate areas, and ensuring all new or suspected cases are reported to the state.
Now, I reached out to this facility and Pruitt Health. Neither have responded to my request for comment. I also want to mention that resident tells me he did notice some changes in procedures and protocols today. He hopes those help keep him safe. Live in Durham, Amy Cutler, CBS 17 News.
Of the areas needing those tests is nursing homes and living centers. CBS 17's Amy Cutler is digging deeper tonight to show us how those facilities are coping. Amy.
Yeah, Marius and Angela, it is a real challenge. They've got a lot of people in close proximity, many with compromised immune systems. Tonight, we're learning more about a resident that was at this facility and died from complications of COVID-19.
It kind of took a toll.
Ryan Benson is heartbroken over the loss of his mother, 72-year-old Virginia Wilcox, or as she was better known, Jenny.
Outgoing, loving. She loved telling jokes. She loved being around people.
Wilcox had some health problems and lived at Wellington Rehabilitation and Healthcare in Knightdale for the last 3 years. Last Thursday, he got the call.
They were sending my mom up to the hospital because she was running a fever and was getting sick to her stomach.
Benson says she was diagnosed with a staph infection and later tested positive for COVID-19. The antibiotics didn't work. Her condition kept getting worse. Since he couldn't visit, the doctors and nurses at Wake Med set up a FaceTime call Tuesday evening.
It was great to see my mom before, the next day.
Wednesday morning, the 72-year-old died.
It was the COVID that had made all the other underlying symptoms worse, harder to control or take care of.
Wilcox, one of 3 people in Wake County to die from COVID-19. The county health department confirming Wellington and Sunnybrook Rehabilitation Center in Raleigh both have outbreaks.
Whenever there is an outbreak in our congregate care facilities, that we can go and test all the people there and to test staff.
That is being done, but the governor admits they still don't have enough test kits and personal protective equipment.
As for Benson, he tells me his mother will be cremated. They'll hold off on a memorial service for a few months because they have a big family and they want her family and friends be able to get together to honor her life. Live in Nightdale, Amy Cutler, CBS 17 News.
Raleigh city workers want to be tested for COVID-19 after learning their co-worker died from the virus.
We told you at 6 o'clock that 37-year-old Adrian Grubbs died Wednesday from COVID-19. He did have an underlying health condition. Tonight, CBS 17's Amy Cutler talked to his wife, who says the family is still in quarantine. Amy.
Yeah, Angela, all of this still sinking in for them. His wife says Adrian's only pre-existing condition was high blood pressure. She, like so many of his fellow coworkers here at the city of Raleigh, devastated.
He was just a wonderful man.
Adrian Grubbs' wife, Chanda, speaking with me over the phone. Her family now in quarantine after health officials confirmed the 37-year-old father of 3 died from COVID-19.
Very dedicated, hard worker, anything you need, anything you need help with or whatever, he was always there.
Chanda left heartbroken, in disbelief over how quickly this virus claimed her husband's life. Here's the timeline. She says Adrian started feeling sick back on March 11th. The city of Raleigh, where he worked, advising him to get tested for COVID-19, which he did 2 days later. March 16th, he learned that test was rejected. The saliva dried up. He went back to be retested. 3 days after that, he was taken to the ER. His condition kept getting worse. There, he received another test for COVID-19.
My husband was a homebody.
Adrian put in isolation. His wife could no longer stay with him. March 20th, Chanda says they learned he tested positive for COVID-19. 2 days later, the 37-year-old was moved to UNC hospitals. He died March 25th. The city of Raleigh, where he worked in solid waste services, writing, "We lost one of our own and our hearts are broken. We are using every resource available to us to ensure the safety and security of our employees and community."
Chanda now urging people to take this virus seriously. Adrian leaves behind 3 children, 13, 8, and just 4 months old. Live in Raleigh, Amy Cutler, CBS 17 News.
Right now, a lot of families are having a hard time paying for food, and food banks across our state are trying to meet the increased need. And starting tomorrow, they will have a little help. The North Carolina National Guard is deploying to 7 food banks. CBS 17's Amy Cutler is live at one of them tonight. And Amy, how will this all work?
Yeah, that's a good question, Angela. Each of these food banks, we're told, will get more than 3 dozen personnel and 15 vehicles, all of it intended on meeting this growing need.
It's just skyrocketed.
The Interfaith Food Shuttle used to pack 3 emergency boxes a week. Now they do 1,000. They're also producing 5,000 individual frozen meals.
Everything we're doing is geared towards pushing out food for those in need.
About 250 volunteers would come every week to help. But with the pandemic and stay-at-home orders, they've stopped accepting them, except at their farm.
A lot of our volunteers are in that at-risk group of over 65, so it was naturally that we weren't going to have them in anymore.
We know some of our partner agencies have seen an increase of up to 150% in terms of the numbers of people that they're seeing.
The food bank of Central and Eastern North Carolina finds itself in a similar situation.
We're hearing that this has been the first time that they've needed to come to a hunger relief organization. That a lot of folks have just been laid off.
Starting tomorrow, the North Carolina National Guard will be deployed to help. 7 food banks across the state will each receive 40 personnel and 15 vehicles. They'll assist with warehousing, forklift operations, and distribution.
That's a total of nearly 300 North Carolina National Guard personnel and more than 100 trucks supporting food bank operations across the state.
We're hoping with National Guard support, we might be able to increase some of that direct distribution.
Now, the National Guard, again, will be here at these 7 food banks tomorrow. They tell me much of that work will focus on logistics, at least on day 1, so they can decide how best to help. For more information on how you can help these food banks, just head to our website or app. Live in Raleigh, Amy Cutler, CBS 17.